Hi, guys. Well, I hope you really enjoyed meeting Terry. She's an awesome respiratory therapist, has been one for a very long time, very, very long time, which is awesome because of all the knowledge that she has. So that's why I asked her to come on the show to discuss with you guys some things about respiratory therapists and nurses and our relationship together. Only thing I do want to add, because she's just being too kind to even say this, but just like a lot of people, especially nursing students, I know you're aware, and the nurses are definitely aware, that there is a major shortage in nursing. It has been before I was even born. Yeah. So, but guess what? It's the same with respiratory therapists. And I bring this up to say that they truly need our support. And I'm not pointing out names. I'm not saying where and when and all these other places. I've worked at a lot of hospitals and a lot of different experiences, a lot of different people I've met, wonderful people. But I have met, nurses, unfortunately, that sometimes like, the therapist will get it. So that's not cool because a lot of times I've seen situations where there's one therapist and like, oh my God, 40, 50, 60 something beds, and it's one therapist. Maybe somebody called out sick, or they were in between, one therapist may have left and had a better offer somewhere else and went to another facility, or was juggling two jobs and said, you know what, this is too much, let me just stick with one. And that leaves the other therapist there with really no one while they're waiting for the facility to hire and screen someone new. They're never going to complain about that because all the ones I've met, they're just awesome. I mean, oh my gosh, like no complaint bone in their body. But as nurses, we really need to pull our weight and really jump in there and help. And I know we have a lot on our plates too, because you kind of have to know the job of the therapist, the dietitian, the doctor, all these people, because they expect you to kind of know some of everything, because you have to kind of jump in and kind of help everyone in their role, so to speak. But that's what nursing is. It's not. You're never going to just stay a nurse. You're nurse, part respiratory therapist, nurse, part whatever. But they need our help because they are very overwhelmed, and we don't want anything happening to them. They're constantly run, 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 run. And then, God forbid, that code is called overhead, which is quite frequent. Well, when I say quite frequent, it may be each hour, every other hour. It's a lot on that therapist because then everything has to be dropped and they have to attend to that too. So definitely do your part as a nurse. And as a nursing student, just remember, as soon as you graduate, most hospitals have it set up where you're going to spend a little bit of time with different disciplinary team members. Some places don't, but some places do. I've been to both. But you should be in a situation where you should be comfortable enough to go to your manager or your current preceptor or your nurse supervisor or nurse supervisor or charge nurse and say, hey, I would really like to have a share day with one of the respiratory therapists to see what they do, how they do it, and what do they recommend, for me to do when I'm working with one of them or them as a team. That's huge. Yeah, because you really don't get to see all the stuff they really have to do, truly, unless you do at least a share day with them. So any great manager, preceptor, which is pretty much everybody, they will understand that you want to grow in that area and they will appreciate that you actually requested that. So again, help your respiratory therapist. We work as a team, all for the safety of our patients and giving them the best outcome. And again, I'm sorry I forgot to mention as part of the team members, the family. That's like number one. They are the support system. And a lot of times I've had patients say, what, I've kind of given up. And the cancer has taken this route, or I don't feel like I have a quality of life anymore. Whatever the issue may be, and there's some serious issues out there, guys. A lot of them will tell me, I'm hanging in there for my daughter, or for my son, or another loved one because they care so much about their family member. So without that family member support, this person may not even make it because they were pretty much giving up on life without that family member. So again, I am so sorry that I forgot to mention that earlier, that the family is a very huge part of the interdisciplinary team. which means in the hospital, it's the nurses, the doctors, case managers. We all get together, usually on a phone type interview call, because not everyone can physically make it in. And whatever family member is in charge of that person's care, governing that care, making those medical decisions for the patient when they're unable to do so, they should always be included in that. And of course, case management and the right people in the hospital, that's really their job to figure out who they were legally supposed to be speaking to about that patient. But they're a huge part of the team, and sometimes they may be the only reason why that patient is fighting hard to survive, because they're trying to be there for that family member can't quite handle losing them at that time. Okay, so again, support your respiratory therapist. I hope you learned something from today. And take care, stay present, stay positive, and wake up each day with the attitude of gratitude, because believe me, as nurses know, and as nursing students will soon know, people are dying like every day. You have to appreciate your life and focus on not complaining, but focus on all the things that you appreciate each day. And because not everyone has that. Okay? Attitude of gratitude. See you later, guys. Don't forget to like, subscribe, and hit the notification bell for Skill Snacks. Have a good one. Bye.